Indigenous peoples tend to be a youthful population. And so, if we get this right with young people, then we know that their health trajectories are much likely to be better throughout their lifespan. So,
hello everyone, welcome to the Reproducibility Podcast, a space where we, a group of researchers, foster discussions on papers and diverse issues surrounding ways to improve research practices, and broadly, anything under the realm of the open science movement. My name is Queen Saikia, and I'm a researcher at the University of Leeds, UK, beaming in from the gorgeous city of Leeds, where I'm surprisingly accompanied by bright weather today. It's my honor, along with my wonderful co-host Sarah, to welcome 3 guests from New Zealand, specifically from the University of Otago and the University of Auckland. Today we'll be discussing a critical issue, the health and well-being of Indigenous people in New Zealand, along with several related research areas explored by our guests who have dedicated decades to studying these topics. It's my pleasure to welcome Professor Sue Crengle, Professor Terryann Clark, and Dr. Andrew Sise. Now I'll pass the virtual floor to my co-host Sarah to introduce herself. Over to you, Sarah.
Yeah, hi everyone. I'm Sarah. I'm a lecturer in psychology at the University of Lincoln. I am an immigrant on this land, and my relationship to it is as this immigrant. So I'm grateful to live and work here on the land of the people who colonized the land that I called home for most of my life, which is still called Canada. And I'm very excited to be here to speak with our guests about research with Indigenous peoples. So I'll pass it on to them to introduce themselves.
So, kia ora, greetings everyone. My name's Sue Crengle. I am a professor of Hauora Māori or Māori Health based in Dunedin in Aotearoa, New Zealand. And my iwi or tribal affiliations are to Kaitahu, Kaiti Māmoe and Waitaha. Kia ora.
Kia ora koutou. Greetings to you all. My name is Terryann Clark, also known as TC. And I am a professor in the School of Nursing at the Faculty of Medical Health Sciences at the University of Auckland. My tribal affiliations are Ngāpuhi, Ngāti Wai, Ngāti Whātua ki Kaipara, which is from the very far north of the North Island in New Zealand. So yeah, great to be here.
Kia ora, my name's Andrew Sise, and I'm talking to you from Dunedin, down in the bottom part of Aotearoa, New Zealand. I am a public health medicine registrar, hopefully soon to be finishing off my postgraduate training in public health. And I'm here to talk about an Indigenous health topic, but am not an Indigenous person myself. So I'm Pākehā, or New Zealand European, and mostly descended from Scottish people who arrived here in the southern part of Aotearoa, New Zealand around the 19th century.
Great. Thank you so much. It's great to know you all, and we are very happy to have you and talk about the work that you have been doing and as a collaboration as well. And especially, it's so essential to know what differences it makes, like especially when it comes to Indigenous research, like health, adolescent health, or any age group in general. So I know we all started with one of the papers that you have recently published, and it's on basically talks about the health and well-being needs of Indigenous adolescents, a protocol that you used to study. So could you share something about it, like what was your motivation behind, and what were your key conclusions?
So I might make a start and then hand over to Andrew and to TC. There's a number of people that work in the area of Indigenous youth globally around the world. And the collaboration, so there's a collaboration of these people from across the world. A couple of people from Australia actually have been the key drivers of bringing us all together. And we're very interested in doing a global piece that looks at the health and well-being of young people. In New Zealand, we call them rangatahi, as young people. And this piece of work is a protocol for a literature review looking at health and well-being and what young people in particular have been saying in different jurisdictions around the world about things that are important to them around their health and well-being. I'll hand over to TC and Andrew.
Yeah, I mean, one of the things that's intriguing to me is that Indigenous peoples worldwide see, we have a colonised history with a really predictable set of colonising traumas that have happened that have resulted in really inequitable health outcomes for a range of different developmental age groups. What I think's really important about addressing these inequities for Indigenous youth is that Indigenous peoples tend to be a youthful population. And so, if we get this right with young people, then we know that their health trajectories are much likely to be better throughout the lifespan. So investing in children and young people's well-being is really, really important. If we want to get Indigenous health right, that's where we have to invest some time and space. And so one of my roles as the Cure Kids Chair in Child and Adolescent Mental Health is that I'm really focused on mental health. So we've seen this really dramatic increase in young people's distress and mental health issues. So for instance, in New Zealand, suicide attempts within the previous year are about 13% for Māori young people or rangatahi Māori, whereas they're around 3.6% for New Zealand, European, Pākehā young people. So huge inequities that really are not being currently met. And we see this similar pattern throughout the world. So really important for us to look at those patterns, look at the similarities, but also the unique differences between us as Indigenous peoples.
Yeah, so I was really lucky to become involved in this project when we were developing the protocol for this big scoping review that we were doing. So in order to, I guess, set the scene for the wider work of the global collective that Sue and TC have been talking about, we thought that it would be important to go and look and see what research has been done already in terms of what Indigenous adolescents in different countries see as important in terms of their needs and priorities for health and well-being. And so that's kind of the foundation, the foundational idea behind this protocol that we've published, is we're trying to, I guess, set the scene for a study to go out and identify what types of qualitative literature have been published on this topic and look and map it in terms of where it's come from, different regions, different peoples, different age groups within the age range that we're looking at of adolescents, and try and work out what those different needs and priorities are that have been reported to sort of try and inform our further efforts to look into Indigenous adolescent health.
Yeah, awesome. Can you talk a little bit more about why you specifically are focusing qualitative research? So, dominant science is generally dominated by quantitative research, and so is open science. And so what motivated that parameter, I guess, that you're focusing specifically on qualitative research?
Yeah, sure. So I can start out talking about that. So I guess, and it will be interesting to get Sue and TC's perspective on this as well, but I guess with quantitative research, we, as researchers, might be setting things to measure or issues to look at or questions to ask people, which we then get a response, which we then collate and bring together. With qualitative research, we're wanting to look more for studies where researchers have gone out and talked to adolescents and kind of discuss these issues in a more open way. And I guess we're hoping that through that, we'll be able to get what young people themselves actually bring up as being important. And they might be things that, if we were setting up a quantitative survey or going out and collecting and looking at health data, which we might not necessarily have thought of. So it's the kind of go out and see what's been reported in these studies of perspectives of young people themselves. Do you have anything to add to that, Sue or TC?
Yeah, I agree, Andrew. And I think it's providing the context and the voices of young people through that qualitative work. We do plan as a subsequent step to look and see what quantitative data there is around. But first of all, we wanted to understand what was important to young people.
Mm-hmm. I think qualitative is often linked or used, right, for exploratory research more, because that's how you figure out where the issues are, right? That's how you start. And so I really appreciate this approach of mixed methods. I've read a couple of papers recently on what I've been called, I think it's small I Indigenous research, local based research, where people in, say, Iran are like, oh, there's this concept called hiret. We don't really know anything about it. Let's start with a qualitative study and see what's out there. And then based on that, we can generate some hypotheses, and then we can go into more depth with some numbers. But the first important step is to get people's voices and to get that baseline.
Definitely.
Absolutely.
Yeah, I've got a really good example of that. We really wanted to do this sort of population youth mental health project in a community that had quite a lot of suicidal ideation, and there'd been some suicides in that particular area. And so we decided we'd go in and we wanted to do this mental health project with young people. And they were like, no, we don't want to do that. Actually, we don't want to talk about mental health. What we're really concerned about is that we want to be able to swim in our rivers again, and we want to clean up our river so that we can all swim in our rivers again. And so we thought, well, okay. So what we did was that we partnered with the local district council. We did a community cleanup of the river and got all the rubbish out, and the council donated a whole bunch of plants for riparian planting to help keep the river clean. And throughout this process, the young people were organising the community. And so they got to know people in the community got to see that there was really there were some young people who were really interested and engaged, and people often have a really negative attitude about young people. So the young people were leading it. They got to know people in their communities, and it ended up being a really important mental health intervention where people were talking to each other. They felt like they were doing something for the future, and that they were of benefit to their community. And so, sometimes we start off with this very deficits focus about what's wrong with young people, and actually what they want us to see is all the things that they're capable of and all the things that they can contribute. So, when we look at health from an Indigenous perspective, it is far more holistic. They are thinking about their environment, they're thinking about the future, they're thinking about a whole bunch of things that in our compartmentalised health system we don't necessarily see as health. So really important to understand the perspectives of young people.
Yeah, 100%. I've come across quite a bit of work trying to shift explicitly from deficit to resurgence thinking and strength thinking, particularly in Turtle Island and the research going on there.
Yeah, we in Indigenous health, we like strengths-based research or strengths-based analysis and approaches because, we've heard for decades and decades and hundreds of years about what our deficits are. But actually, if we're healing and if we're progressing, then actually we need to build on our strengths and capabilities.
Absolutely.
I totally like the beauty that of the qualitative researchers and qualitative research as a whole as we can interpret. I'm a quantitative researcher primarily, and what I see that we are as qualitative researchers, we're too focused on only one particular topic, and it's very much informative in a way, but in addition, if we can have a mixed methods, like Sarah said, like if we can have a qualitative research in addition, it gives a very smooth concept, and we can pull out different ways by which we can provide community learning, as I think TC mentioned, that you could observe in real time how the young people were involved with themselves. So yeah, that's really great.
I think both TC and I are both very keen on mixed methods research, so that we have numbers, but we also have stories and experiences from people that actually adds real depth to the numbers and increases our understanding of those numbers.
Yeah. 100%. And I think when we look internationally at what data people have available, it's really varied. And, in Aotearoa, we've been lucky with Sue and I were part of the Adolescent Health Research Group, which set up national youth health surveys that are done every 4 to 5 years to kind of track progress and see how we're going. So we've got really good quantitative data, but lots of Indigenous nations do not. And so it becomes much harder to advocate for good services and public health policies and programs if you don't have the evidence. So I do think they sit hand in hand, and you've got to be capable and willing to be able to negotiate both of those worlds.
Absolutely. I noticed that the protocol is published, was it over a year ago now? So has the process started? Are there any findings? What is the kind of stuff that you're finding so far?
I think that the searches have been done.
Okay.
And the papers are being collated and sent out to the various jurisdictions.
Gotcha.
We've had a wonderful young person working her way through our set of papers, and I think TC, you've got a bit of you know where Ariel is at, eh? But no results so far.
Fair enough. I feel it was a big undertaking.
Yeah. And we don't want to spoil it.
Yeah, fair enough. It's a huge undertaking. I was struck by how ambitious it was. I think critical, really important work, a huge undertaking. So yeah, very impressive.
Yeah, I mean that's where qualitative research is really, it's not just a count. So it's a lot of work, and so we've still got a ways to go. But actually, we're making great progress. We've identified all of the articles, and we're just in this sort of sorting and theming part of what we're doing now.
That must be a very exciting time, because you get to see all the really cool work that's happening around the world and get some idea. And yeah, I think that would be just a really exciting thing to do.
It is. And another work that I've done that's had a kind of international focus, it's always when you get towards the end and you're all sharing the information from your own areas or countries, it's always fascinating to me what our similarities are, but also, as TC mentioned, our differences. And although we come from very different, we've places, for example, the Sami in Scandinavia, or Indigenous people on Turtle Island, Australian Aboriginal and Torres Strait Islander people, and ourselves, Native Hawaiians. So in many ways we're quite diverse. Our experience of colonisation is very similar, and it's had some very similar outcomes.
Yeah, it just occurred to me, I'm not sure if everyone knows what Turtle Island means outside, for any listeners. Yeah. So Turtle Island is the Indigenous name for North America. So that's Canada, US, and Mexico. Yeah.
That's actually helpful for me to know, because I was not aware of it before. Yeah. In terms of, because you have conducted both, what differences did you observe during your study while you were trying to, go forward with your Indigenous and non-Indigenous populations? In the study that you made a comparative.
Oh, okay. So that one, we were looking at infant and young child health, and so there was some differences in the extent of some of the more adverse health outcomes, and some differences in the extent of the inequity between the Indigenous and non-Indigenous people. Our socioeconomic kind of positioning and those types of things were very similar. And this was a study that was done in Australia, New Zealand, and Canada. And so very different, I guess, so, Māori, for example, settled New Zealand through Polynesia. Australian Aboriginal people are more from Melanesia, and then the First Nations and Métis people in Canada are quite different from their kind of origins as well. So although we have those different backgrounds, actually our experiences were much similar and very, I think, a result of the colonialism and the sociological constructs behind our experiences.
Mm-hmm.
Right. In terms of I would like to go back a bit into the methods and in the scoping protocol that you have, produced for the paper, for the work. What kind of, to what extent are you do you keep the data involved? Like, how do you deal with the data, and specifically, how often do you put it forward?
So I guess in many ways the publishing of the protocol itself is a way of trying to ensure that we're being open with this. So as we were alluding to earlier, the study itself has only, and I can't really speak to the main study because I've mostly been involved in just developing the protocol, but the study itself has only really just been started. But with the publishing of the protocol, I guess that's important for a couple of reasons. Firstly, it lets other people around the world know what we're planning on doing, so as that people know that this review is likely to be or going to be undertaken. And it also allows us to kind of set out a recipe for how we plan to conduct our study. So I don't know if you will have seen, but we've published the full search terms that we plan to use as an appendix, and all the different databases that we're going to, all the major databases, sorry, not some of the minor databases, those major databases that we're going to search, and also our things like our plan for what types of studies we're going to be looking at, how we're going to define whether things are eligible for inclusion or not, and then how we're going to aim to bring all of that information together. And I guess with this type of thing, it's slightly different to doing a quantitative analysis. So, for example, we can't put our R code up online for how we're going to actually analyze these data because a lot of that will involve human judgments about what's included and what's not included. But we can certainly publish our inclusion and exclusion criteria and say what we're planning to do. And then, as the study's undertaken, things might come up that we weren't anticipating, and we can note where any variations are made.
And I mean, obviously, it'll be published, so it'll be in the public space, and the papers and things that are included are all publicly available as well. So the primary data for the scoping review is publicly available.
Okay, so all of the papers had to be open access to be included in the review?
No.
Good question, and no. So there are some limits on, unless you have access to papers that are paywalled, then there are some limits on your ability to access that.
Yeah, and I guess one of the challenges of researching this area is that we're not sure how many papers there will be available for some areas and some some people. So we're wanting to, and that's one of the reasons why we chose to do a scoping review, which is a really kind of taking a broad look. We're still using a predefined systematic search like you might in a systematic review, but taking a really broad look and trying to sort of map out what literature is available, and also including literature quite broadly, so both open access and non-open access, peer-reviewed literature, and also grey literature, which maybe there'll be some important things which are found there that we wouldn't have identified otherwise. Things like government reports and reports from other organisations that we might turn up.
Yeah, for sure. I had a question and it flowed out of my head. Okay. never mind. It'll come back to me.
I think, yeah, is you have where there. I think Andrew, you have mentioned about some of the limitations. What is, if you were given a different method, like apart from the scoping review, what else do you like to have an overall understanding of the situation? Is there any other method, or like what would you like to suggest?
I think one of the things that we are doing is that, whenever you do these inclusion exclusion criteria, we have to make sure that we're being consistent in the way that we're doing that, right? So we have, we've tried to apply those same things throughout all the different nations, and then each nation is going to analyse their own data set. And so one of the things that we are also going to do within our nations, so for instance, Ariel, who's doing the sorting at the moment, is going to come back to us with any questions, with any concerns, or, if there are some articles that might be fitting the criteria but they're not quite sure, they'll come back and talk to us a little bit about it. So that we're sort of making a little bit more collective decision making, but also just kind of checking that we know of a lot of the reports and discussions and grey literature that's outside of these normal searches that might be really important to have in there and to ensure that they are there as well. So there are a number of quality checks and, member checking within our group to sort of make sure that we are being consistent in the way that we're doing it within the New Zealand context. And then my understanding is that we're going to come back together as all the various jurisdictions and kind of talk through those decision makings to make sure that we are being consistent in the way that we're applying the protocol.
I remember what I wanted to say. It wasn't a question. It's more of an observation. So how I understand open science is it has been sort of taken over by the global north in the past decade or so, and it's become very quantitative and it's become very much mainstream. And I've not seen very much, I guess I would say, marginalized research taking on open science principles. So is there anything in particular that motivated you to do this? So otherwise I think it's really cool that you're sort of modeling a way to do transparency for different types of research and data that serve people more than just the quantitative stuff.
I think open science can be particularly challenging. As an Indigenous health researcher, I can find it particularly challenging, particularly around, if you've done some quantitative work and you're submitting for publication and you're asked, is your data openly available? And that can be challenging because we have a long history of harm being done to us by non-Indigenous researchers. And so and there's a risk that if Māori data, the Indigenous people of New Zealand, Māori data is openly available for anyone, that actually harmful research, harmful results, harmful conclusions will be drawn from our data. And to date, we have, in all projects that I've done where we've been asked that question when we're submitting publications, we say it is not openly available. If people want to access it, then they're welcome to get in touch with the author, the communicating author, and usually we would have a data access policy, and if people wanted to use that data, then they would have to do the data access application and be very clear about what data they wanted, the purposes that they wanted it for, what their analytic framework and approach would be, and a number of other agreements before there would be, but any data would be released to them.
Absolutely. Is that something that you do for your lab and your data, or is this a national framework, like a Māori framework?
There is some agreed, we call Māori data governance principles, and they're kind of agreed nationally, but really the extent that they're implemented and the kind of ways that they're implemented vary very much from project to project. Yeah.
Fair enough. I know of similar protocols in what's now called Canada for data access, but it's not in the same level as like we have, say, ethics committees on universities. Like it's not that systematically implemented. But I know there's definitely a push around data ownership to say like Indigenous people should own our own data and like buzz off. This is not for you, and you need to ask us if you want it. So that there's definitely the OCAP principles, I think they're called in
yes, they are.
It's now called in Canada. Yeah. I forget what it stands for. I can't do it off the top of my head, but there are similar protocols.
Yeah, we have Māori data sovereignty, manaroranga principles, which are similar to that. I think one of the things is there's more than just around data access, it's around data analysis and interpretation. And so, often people feel that quantitative data is
objective. Yeah.
It is free from bias. But actually, I see lots of quantitative data being used in really harmful and deficit framing and ways that are really unhelpful. So, one of the things that, I've learned from Sue is that we do have, every study we have these data access protocols so that if people do want to access Māori-specific data, that they fill these things out, but they're also being led by Māori who are then interpreting the data. And so that's, I do think the fact that we are Indigenous and we're interpreting Indigenous data is really important in qualitative and quantitative data.
Yeah, 100%. This is something that I try to really emphasize in my teaching with methods, is that there's always context. Quantitative data is not free from bias. There's no such thing. You can never, ever be free from bias. You're always making choices, making decisions, and interpreting data. Everything is mediated always. And yeah, I think it's so important to understand that as researchers in whatever context we operate in.
And also, we have our own biases.
Sure.
So the way our understandings of the world and our understandings that inform the way we interpret data have our own biases as well.
Yeah, the way that I say is we have a worldview, because you can't not, you can't be outside of that. So you have a way of seeing, and that's it. It's okay to acknowledge that. It's important to acknowledge that, not pretend it doesn't exist. And that I think is the core and most important thing to do.
That's really interesting how it can vary from person to person, even from group to group. And when we talk about like different regions, it's different regions around the globe. It's so much variations across. So I'd like to pass on into our third segment. We call it Spill the Tea. And I'd like to know something about from you about some of the discrepancies that you might have faced, like in terms of funding or in terms of getting published, like especially when you had a proposal that for the Maori research, Maori health community, for example. So did you face any kind of discrepancies like funding, and what were your takeaways from that?
I think with this project that we're talking about tonight, a real challenge has been, and we haven't been able to do it yet, is to get funding to bring all of us together, which I think would be really helpful. It's great when you can get to know people face to face and talk with people, and I think it would help accelerate the project as well. But it's very difficult to get funding to do that, to fund a global meeting. So I think that's one thing that's difficult, and I don't know whether it's because it's Indigenous, because it's youth, or whether that would be a challenge regardless. So I think that's been one of the challenges.
So just to clarify, this is unfunded. So, I know that Pete has managed to get a little bit of funding, but most of us have absorbed this into our roles. And I've managed to use one of my research assistants to do some work that's come from another project. So, a lot of what we do to advance indigeneity and Indigenous health often comes from an unfunded place. And so, I do think that in Aotearoa, New Zealand, we have got Indigenous-specific funding streams, which allow us to be able to be unapologetically Māori and Indigenous and kind of identify issues that are important for us. Is that equitable? Hell no. Is it easy to get? It's still really incredibly difficult, and we still have two very high levels of scientific integrity, rigor, yes. So I couldn't find the word there. And so, I do think that this is an ongoing struggle for most Indigenous researchers. I think many countries, like I was talking to one of my Sami colleagues, trying to get funding for their work is still very at the beginning. It's still they don't have a lot of access to Indigenous specific funding, and so there are real struggles for a lot of Indigenous peoples to do their work. We're hopeful, and we are advocating, and we're trying to change the way that things are done, but we are really reliant on the political game of the day. And so at the moment we have a more conservative government, and so advocating for Indigenous and equitable outcomes goes through ups and downs in the political cycle, I guess.
Yeah, and I think another thing is, if you're in an academic position and if your institution believes in things like H indexes and numbers of citations and high impact publications, when your major focus of work is Indigenous research and Indigenous health, then that can be very difficult, because, the Indigenous health is not something that necessarily high impact journals want to publish. And also, actually, what do you mean by high impact? Because for us, publishing our work in different fora, in Indigenous journals or in reports or policy briefs, may have more impact than publishing in fabulous journal X with an impact factor of 500, Exactly. So, that can be very challenging if you're in an academic position.
True.
The gatekeeping is strong, hey?
Yeah.
I'm sure that we're not the only, minoritized population that experiences those types of challenges in academia.
So within New Zealand, how are the metrics being assessed? Like especially within your own university, I'm interested to know what assessment criteria do you prioritize in, because obviously impact factor journals and all those should not be considered as a prime thing. So what other metrics do you consider?
I think that in the academic institution I work for, and for example, promotions processes, there is no clear, specific criteria for the work that you might do in terms of Māori health research with Māori communities, etc. They're kind of judged as service work, and publications and impact and H indexes and things are all part and parcel of it. So it very much is, and so it's a matter of, when you're applying for promotions, actually of framing what you're doing within those very Western academic criteria. I'm not sure about your institution, TC.
Oh, totally. I just sort of want to highlight that Sue and I are a very rare commodity in academia in New Zealand. In the University of Auckland, there are 2 full professors in the Faculty of Medical Health Sciences. So it is very difficult to become who are Māori. So, it's incredibly difficult to be recognised for the work that you do. And on average, PhDs amongst Indigenous peoples is around 10 years later. So, people are beginning their academic careers at an older age, and so therefore working through the promotion and all the metrics takes a really long time, and many of us are often overlooked, because when you look at the gender pay parity and the ethnic pay parity, it's appalling. So and I think you'll see this pattern across universities, that really privilege quantitative, high impact type research, whereas a lot of Indigenous research is about communities, and it might take you 5 years to get the trust of a community to do a piece of work, and then you might get a couple of publications out of it. So that kind of career trajectory will mean that you are working much longer, and and a lot of social scientists find it really difficult to get promoted. So, I do think that publishing is something that some of us manage to do, and then others really struggle. And I do think that, as Sue said, sometimes for me, being able to write a policy brief that is used to then advocate for service development change is far more impactful thing than getting a high impact journal. And so I do feel like our metrics are really false about contribution, and we all have to have these international collaborations to be seen as a leader in our area, when actually why can't we just value the expertise of local recognition and localized expertise? So, yeah.
100%. And I mean, I'm thinking of approaching it a little bit more just because that's my next step. It's not, for several years still, but already thinking and observing and seeing who's getting promoted and who's not, and this whole process. And it's tricky, especially because my university is currently in struggling financially, and so they're trying very hard not to promote people to save money. And so you can sort of see the patterns. At the same time, the UK is shifting to valuing impact, what they call impact, but they're not measuring it based on journals. They're measuring it based on what is the social good that your research is doing. That's what they care about now, a lot more than they did before. So I don't know if that would help if other nations' national frameworks also moved towards that, to make space for Indigenous research and community-based work in different ways, or different marginalized population research. Because you can write that story, right? Impact case studies are a huge part now of research. They're a huge part of the research excellence framework in the UK. And so they're starting to care a lot more about how is your research actually impacting people?
And that's a very positive move, I think. One of the challenges in that is that, and I don't know in other fields, but in medicine, moving research findings and, for example, interventions that are clearly evidence of good effect, getting them implemented. There's a thing that says it takes on average 17 years if they get implemented at all. And so it's great to be looking at more of what the actual real impact, the social impact, the health gain impact is of your research. But when you've got implementation blockages, that also has its own particular set of challenges as well.
Absolutely. I mean, it can vary so much, because some studies may lead to like a very fast impact within like 5 years or 3 years, but whereas it might not be useful when you are trying to implement on a society level. So it's yeah. And I think we have almost come towards the end of our segment today. So I'm just wanted to ask, what would be the last words of encouragement for people who you think who are working on, Indigenous research or any globally less popular research? What would be your advice?
Sise, go first.
One of the things that I think is really important is that Indigenous and minorities peoples often need their issues prioritised, amplified, and funded. And so one of the things that's really increasingly important is how do you work with really good allies to make sure that research is getting done. So and we can't do it all. There aren't enough of us. And so I know Andrew will talk to this, but how do you work effectively with your allies to ensure that you're not the only one in the circle who's constantly advocating for Indigenous health? Because that's a lonely journey if you're just the only person doing it. So be a good ally. Do work in partnership with Indigenous peoples. Do be curious about different ways of doing things, because I think in our attempts to address universalism and make sure everyone's getting the same, we're actually disempowering certain groups and their preferences and their needs. So really be curious, be engaged, and work in partnership.
That's great advice.
Andrew?
Yeah, so I guess I'd speak a little bit to working in the space as a non-Indigenous person. And I think, I'm coming here from Aotearoa, New Zealand, and certainly improving Māori health is all of our business in health here, and it's something which is really important to be involved in. But I guess the key things I want to say are that good intentions in themselves are not enough, and if you are, as a non-Indigenous person working in this, being involved in this space, I think a real key thing is to respect and really understand the importance of Indigenous leadership, and I think that's come through in what TC and Sue have been talking about. It's really key to understand how important it is to have in this sort of work Indigenous leadership and self-determination. Whether you're working in a big global project like this, or at a very community-based level, and also to understand your own culture and assumptions and experiences. So I guess and the history of the place where you are working and living in. So I guess we often talk about understanding other people's culture, but it's almost equally, if not more important, to understand how you think in yourself and how that might impact on the interactions and assumptions that you make, and to be able to think critically about that. As a non-Indigenous person, you can contribute effectively in different ways and depending on your skill set, but keeping that in mind, I guess you're not. I don't see myself as an expert on Indigenous health issues, and it's certainly important to know that you don't know what's best for Indigenous people. So that kind of it's key that this type of project in particular is a good example of that, but also in other areas where people might be working, that you have that leadership by Indigenous peoples themselves. And I think that's important, even if, as I have been, you're working as a relatively junior member of a team. It's important to understand that to work effectively and support a research project like this.
And I would just add, I agree with both what TC and Andrew have said. And what I would add is actually working collaboratively, Indigenous and non-Indigenous, is good, and it can be fun. And I think you need to find your people and develop good, strong working relationships and enjoy it and have fun. And really, I think that's a message for, especially for early career researchers, whatever area you're working in, is find your people and have fun with it as well.
Yeah, find your people is huge. Will and I have just talked about starting our lectureships the past couple of years, and that's been really important for us to find our people in the departments. Find your place, find who you're going to work with, and enjoy. There's something that Academic Aunties, a podcast that I listen to, also emphasizes. They feature women of color in academia, and they talk a lot about finding your people and finding the joy in the work that you do.
Absolutely.
And trying to not let the academy get you down, because it will if you let it.
Exactly. So I think yes, we have come towards the end of this session. So thank you so much. It's been such a nice, I think it's been a very rich discussion, I would say, because we have got to learn a lot about the methods, about your background, and then also we ended up knowing how you can improve it, or how we can go ahead and stay motivated with it doesn't matter what the system tells. Thank you so much to all of you. We are very lucky. And Sarah, do you want to add something?
No, just also my gratitude to our guests for sharing, for bringing their experience, expertise, and speaking on this really, really important topic. I'm really glad that we're able to include this in reproducibility.
Thank you very much. It's been a pleasure.
Yes. This is a request to our speakers. If you want your email addresses or any contact details to be made available to our listeners, you can let us know, or what would be the preferred mode of communication from anyone who would be interested after this.
I'm happy for my email to be shared.
Okay.
Me too.
Otherwise, is there anywhere that we can find you online if we want to find out more about the work that you do? Are you on social media, or is there a website that shares the project?
No, none of those things.
Okay.
I've given up on social media.
Mm-hmm.
Yeah, same.
Yeah, no, we've given up on the X anyway.
I now say, go check out my staff profile. That's how you get a hold of me.
Yeah, that's right. The staff profile for me at the University of Otago, and for Terryann at the University of Auckland.
What about you, Andrew?
I'm probably reasonably hard to find at the moment. I'm also like you guys. I don't have much social media, and the email that I've got is my personal one, so probably wouldn't share that.
No,
I don't do that.
Okay.
Yep, no, that's
but
fair
if
enough.
people want to specifically get hold of Andrew, they can come through me, and I can link them up with Andrew.
Happy with that.
Yeah.